Our distinguished speaker for today became the founding dean of the Oakland University William Beaumont School of Medicine in September of 2008. He came to Oakland University from the University of Illinois at Chicago, where he was the Francis Giever Professor and Chair of the Department of Pathology. He also was a Professor of Ophthalmology and Visual Science at University of Illinois, Chicago. Perhaps most importantly, he believes, as we do, that the practice of medicine requires more than a knowledge of science. It requires humanism and compassion. Please join me in welcoming Dr. Robert Folberg.
Thank you, Dean Sobel, for your introduction, and thank you for inviting me to participate in this milestone event in the life of the Wayne State University School of Medicine and in the lives of its magnificent class of 2019. So to our graduates, I begin by offering my congratulations. You've completed a very challenging curriculum, and as President Wilson said, today you become our colleagues, and we are all very, very proud of you. On this day, when you transition from medical students to medical doctors, it seems appropriate for me to begin by sharing something that I experienced about 50 years ago. You see, I began to lose vision in both of my eyes as a teenager. My vision loss was a result of a degeneration of the cornea, the clear front part of the eye. It's a condition known as keratoconus. I lost vision in my left eye very rapidly after the diagnosis, to the point that I could only see shadows moving across the surface of the eye. The condition was so advanced that the traditional treatment for the condition, that wearing a rigid contact lens, was not an option for me, and so I was scheduled for a corneal transplant. I remember the first time that the patch was removed from the eye and I could see the edges of a table converging at a corner, and I was so overjoyed that my vision had been restored. And you know, I'm grateful that that graft remains clear to this very day. My surgery was performed using a technique that is now outdated, because today corneal transplantation is an outpatient procedure. But back in the day, I was in the hospital for more than 5 weeks, and the sutures were removed from the eye under general anesthesia somewhere between the 3rd and the 4th week. Now, 3 days after the sutures were removed, my surgeon, an exceptionally well-known ophthalmologist in his generation, came in to make rounds on a Sunday morning. He shined a pen light in my eye, and he immediately began screaming at me. Something about the anterior chamber shallowing. He said to me, "What did you do? Did you do handstands in your room?" I was terrified. And I learned only later that what had happened is that the wound between the graft and my own eye had separated a bit. It was not holding fast, but I was also terrified because bulky patches were placed over both of my eyes. And without any explanation, I was placed in a wheelchair, taken to my room, deposited in a hospital bed, and left alone. I could not even reach for a telephone to call my parents to find out if they knew what was happening or what my prognosis might be. I was terrified that I would lose the eye. Those patches remained over both of my eyes for 3 days. And eventually the wound sealed properly and I was discharged and sent home. Now, during one of my very first postoperative visits, I began to ask many questions. The surgeon, a very intimidating man, turned to the residents assembled with him and said, "He's nothing but a crock." You know, I didn't know what it meant, but I assumed from the tone of voice that it wasn't flattering. And I only learned much later that the word crock was an expression used to describe a patient who had questions or complaints, but no physical basis in reality. And you know, I didn't mind at the time because, after all, I could see. Wasn't that the most important outcome, a brilliant technical result? So let's fast forward to one night during my residency years, not soon after my own commencement from medical school. And this is a story that I first told in the pages of the American Journal of Ophthalmology about a year ago. Probably not many people in attendance today would have read it, so I repeat it for you today. I was in an inner city hospital for my residency when I heard an alert come on the overhead system indicating that a patient was experiencing a cardiac arrest. I found myself only steps from the room, and I rushed in because all of us were trained on the initial stages of resuscitation. I began to work with the nurses. Now, the specialty team, the so-called code team, arrived within minutes, and I was relieved that night to see that the leader of that team was the best and brightest resident in the hospital. Everybody recognized this fact. So I stepped aside, I went to the back of the room because I wanted to see what would unfold. At first, everything went well. But suddenly, the monitors to which the patient was attached began to show a life-threatening abnormality. The alarms began to sound. And then the debate ensued. Which drug to use next? Which procedure to use next? Did you not read that last article? What about the response in the letters to the editor? And the volume of the debate was as loud as the alarms from the monitors. When that best and brightest resident stepped aside, went to the foot of the bed, gathered the bed sheets, and gently covered the patient's naked and shivering body. And in that act, she taught me and everyone in the room that although science and technology might save the patient's life, only an expression of kindness could preserve his dignity. Had that young doctor been a musician, I could have said that I had witnessed a virtuoso performance. She performed in a hospital, but had she been a singer, she might have performed right here on this stage at Detroit's magnificent Fox Theater. You see, a singer who performs professionally must excel in technique, but for a high-achieving artist, it's not enough to sing the notes correctly. When we come to a concert, we expect more than just a technical delivery. Aretha Franklin, of blessed memory, performed on this stage. She possessed a staggering mastery of vocal proficiency. She was known as the Queen of Soul, not only because of the type of music that she sang, but because she sang from her soul. Many artists associated with the Motown label appeared on this stage. Stevie Wonder appeared here twice in November 1969, and then later that year on New Year's Eve. Now, in March of 1973, this virtuoso musician, Stevie Wonder, released a single record. A song, Tuesday Heartbreak, was on the lesser-played B-side. But it's the title of the song on the A-side that is just so appropriate for this moment, because it's something that any one of us assembled in this room might say to one of our new doctors, one of our graduates. You are the sunshine of my life. With that song title and lyric, the virtuoso Stevie Wonder fused his intellect with his soul. You see, he could have written something one-dimensional like, you are the joy of my life, but instead he sent a deeper, richer message with the word sunshine. Because if you're the sunshine of my life, you bring me joy, and like the sun, you generate light and you radiate warmth. So members of the class of 2019, on this commencement day, I invite you to become the sunshine in the lives of your patients. You will not be able to bring joy to everyone. Even so, I invite you to generate light by applying your knowledge and your skills in the service of those entrusted in your care. And I invite you to always radiate warmth, the warmth of altruism, empathy, compassion, and kindness. So this afternoon, in the presence of your teachers, your friends, and your loved ones, I offer a hope that each of you will become a virtuoso physician. One who practices medicine grounded in science and technology, along with a generous expression of humanity that can come only from your very essence, from your soul. May it be so, and may it be so because you make it so. Thank you and congratulations.
Thank you, Dr. Folberg, for your very inspiring remarks on this special day.